Hello everyone, I am Dr. Karthikeyan. After a long gap, I am meeting you all again. Today we are going to see about World Health Organization. In a glimpse, very quick revision. You know, WHO is a specialized non-political health agency of the United Nations. Even though we say it is part of United Nations, it is not a subordinary to United Nations. It has its own constitution, its own governing bodies, own membership and own budget. So this is a special category of organization under the United Nations, but it is not governed by United Nations. It is a specialized independent agency. It was formed in the year 1946. The constitution of WHO was formed by the Technical Preparatory Committee headed by Mr. Rein Sand. Then this 1946 constitution came into effect on 7th April 1948. That is why we celebrate World Health Day. We celebrate every year. This year also we celebrate 2022. So every year we have a theme. This year theme is Our Planet, Our Earth. 2021, Build a Fairer, Healthier World. 2020, Support Nurses and Midwives. 2019 and 18, we had the same World Health theme for 2 years. Universal health coverage, everyone, everywhere. What is the WHO Health Preamble? Attainment of health for all the people of this world, and they are the ones who coined this definition for health, that is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. There are two major policy decisions that are guiding the activities of WHO now. Actually, in 1978, there was a conference which was held in Alma-Ata on primary health care, and that conference proceedings are followed by WHO till today. And second one is the Global Strategy for Health for All by 2000. So based on this global strategy only, subsequently they developed Millennium Development Goals, strategic developmental goals like that. Who are the members of this World Health Organization? It is open to all countries. There are about 194 member states. And all the member states may not be the member of United Nations. That is what you have to remember, because United Nations is a separate agency and they concentrate not only on health, the border security, military, all these things come under the United Nations Peace Council. So some members prefer not to be a member of United Nations, because if you become a member of United Nations or NATO, then you have to send your military troops whenever there is a conflict in some other regions of the world. So some countries don't like Switzerland, because Switzerland is a member of World Health Organization, but it is not a member of United Nations for this reason. And there are also two associate members. Actually, these associate members doesn't have the voting power, but they remain as a member. And all these 194 member states, they will contribute some amount for the annual budget of World Health Organization. There are 6 functions mainly you have to remember. First one is the prevention and control of specific diseases. It can be communicable and non-communicable diseases. Initially, it was started for communicable diseases, and they framed international health regulation. Under this regulation, there are 3 primary diseases: cholera, plague and yellow fever. Whenever there is a case of this cholera, plague or yellow fever in any corner of the world, it will come to WHO's notice through automatic telex reply services, and they will publish every week regarding the incidence of these cases if it occurs in any part of the world. And weekly epidemiological record tells us regarding the every week health status regarding the diseases, communicable and non-communicable diseases occurring in our world. And the WHO member countries can also utilize a WHO emergency scheme for epidemics whenever there is an outbreak in their country. And recently they concentrated on non-communicable diseases also, and under its purview now they have expanded immunization services as a priority service, and also they take part in laboratory and pharmacy quality control measures. Second important function is the comprehensive health services, that is development of the manpower, health infrastructure and giving the managerial capacity for this manpower. And also they concentrate on developing appropriate technology for delivering the healthcare services. So the healthcare services should be modernized. So the WHO plays a role in it. Then third one is family health. Overall family members' health in addition to family planning is concentrated. And fourth one is environmental health, and the fifth one is health statistics. This is another important component where the statistics regarding the health care, not only the diseases communicable and non-communicable, the availability of health manpower and infrastructure services also is published. So it is published under the World Health Statistics Journal. Quarterly publication is also there, and annual publication, yearly ones also is there. And they also update the International Classification of Diseases, ICD, because ICD is essential for health insurance purposes also. Sixth most important function of WHO is medical research. Under the medical research, they give the funding and consultancy support. Regional advisory committee is there, global advisory committee is there, and also they provide funding. Seventh component is health literature and information. They actually maintain a very good health library, WHO library. Actually, it is one of the satellite center for medical information retrieval system by the US based PubMed. And eighth important component and function of WHO is cooperation with other international organizations like UNICEF in the delivery of healthcare services. So what is the structure of the WHO? The highest body, governing body will be the World Health Assembly, which meets actually every year, and only once a year they meet and they discuss regarding the international health policy, what is the future upcoming projects, and what will be their line of work, mode of work, like that. And there is a second level of body called executive board. There are about 34 members now in this executive board from different countries, member countries, and they meet at least twice a year to monitor the activities of the secretariat. Third component, which is actually the active wing of the WHO, is this secretariat. They are the active wing. They have Director General. So now the Director General of WHO is Tedros Adhanom Ghebreyesus, and he is a Chief Technical and Administrative Officer. Under him, there are about more than 4,500 employees are now working under WHO. Actually, for administrative purposes, WHO is divided into 6 categories. That is 6 regional organizations. Southeast Asia headed in New Delhi, India. Africa headed in Brazzaville, Congo. America headed in Washington DC. Europe headed in Copenhagen, Denmark. Eastern Mediterranean headed in Alexandria, Egypt. Western Pacific headed in Manila, Philippines. So these are the regional headquarters. And CRO, that is India, comes under the Southeast Asian Regional Organization, and the current regional director is Dr. Poonam Khetrapal Singh, and there are about 11 members coming under the CRO. So that's all about World Health Organization. Kindly remember to mention these points in your examination to score good marks. If you like this video, press the like button below. Subscribe our channel Community Medicine Made Easy. Meet you all in the next video. Until then, goodbye from Dr. Karthikeyan. Thank you.